step one. So first of all, guys, we have vagus. Guys, recall the vagus is for our relaxation. So essentially, vagus secretes acetylcholine, and that acetylcholine can then go in and stimulate GQ receptors. We also have gastrin, which is also like a gastrin releasing peptide, which also releases from vagus, and that stimulates your G cells, and that would stimulate your cholecystokinin B, and that would activate GQ over here, and that would also go and lead to more protons being released. Then we have the histamine. So of course, like gastrin can then also go out and kind of affect your enterochromaffin-like cells. Because enterochromaffin, entero just means small intestine, chromaffin means like iron, and that would go and then stimulate your hydrogen ions as well. To be stimulated. So that's GS. Okay, GS is going to be there. Then we're going to have somatostatin and prostaglandin. Those are more like inhibitory, so like GI type of stuff. And then we can also have like this transporter on the side. The way I like to learn is like kind of like bicarb says bi and chlorokine clings on, and bicarb says bi and chlorokine clings on. And we also have these drugs called bismuth sucralfate, and we also have another drug which is known as the misoprostol prostaglandin E1 analog, really important drug over here. Then let's come over here into some PPIs. So we have cimetidine, so tidine, famotidine. Essentially, these are going to be blocking. We're going to be an antihistamine. So you block the GS receptor, and you're going to have a decreased amount of proton pump. When we use this, any sort of acid thing, so gastritis, GERD, reflux disease, so gastritis, GERD, reflux disease. That's where we're going to be using these ulcers. Ulcers are really important. So guys, we need to know that these are somehow like they're inhibitors of cytochrome P50. They also inhibit enzymes responsible for testosterone synthesis. So when we have less testosterone synthesis, we're going to be getting more estrogen synthesis that can lead to gynecomastia, impotence, libido, and it can cause very causing confusion, can cause placenta, and it's going to be really dependent on renal secretion. We have PPIs, guys. These irreversibly inhibited hydrogen potassium ATPase pumps. These are going to be again ulcers, gastritis, GERD. Is all like an Anderson. They have many side effects. So if you decrease acid, you get increased bacteria, so pneumonia or C. diff. We can also somehow get decreased amount of B12 absorption. Not sure the exact mechanism. I should check it up though. We can get also decreased magnesium and calcium reabsorption, so that can also occur with these PPIs. So they can decrease the amount of magnesium and calcium absorption, and this leads to fracture risk. Okay, let's come over here. Okay, guys, antacids. So we can see can affect absorption, bioavailability, and urinary excretion by altering gastric urinary pH, and by delaying gastric emptying, and cause hypokalemia. So as you can imagine, hypokalemia, we can see that there's going to be, of course, constipation, hypokalemia, osteodystrophy. We're not absorbing your aluminum hydroxide, we're not absorbing calcium, so we're getting less calcium, more risk of osteodystrophy. But we're also in proximal muscle weakness. So when aluminum levels become elevated, they can cause toxicity, so that can lead to muscle weaknesses and seizures. Then we have calcium carbonate. Again, the same thing. We're not going to be absorbing your hypercalcemia, milk alkali rebound acid, and they're going to chelate the effectiveness of other drugs. So we cannot absorb fluoroquinolones, we cannot absorb tetracyclines. Then we have our octreotide. So calcium carbonate and this drug are very similar in that case, that we cannot absorb calcium in that sense. And magnesium hydroxide, very similar to aluminum hydroxide. So that's going to cause diarrhea, hyperreflexia, hypotension, cardiac, and must go to the bathroom. Guys, bismuth and sucralfate, they require a acidic environment for their activation to occur. So they bind to ulcer, allowing the bicarb secretion to reestablish pH gradient in the mucus layer. And sucralfate requires acidic environment. So don't give this with a PPI or H2 blocker. That's important. Use, guys, is going to be any sort of ulcers, traveler's diarrhea, because bismuth basically has some antimicrobial properties that can help in growth of certain GI pathogens and bacteria, which are associated with traveler's diarrhea. Bismuth is also used in the quadruple therapy of H. pylori. So we can have they're using they're going to be using that H. pylori, the quadruple therapy. Guys, misoprostol, guys, its going to mechanism is going to be prostaglandin E1. So you can imagine NSAIDs, they decrease prostaglandins. Misoprostol increase prostaglandins, so we're going to be using that. So they increase production, secretion of gastric mucus barrier, and decrease acid production. So they decrease NSAID-induced ulcers, and they also they're going to be prostaglandins, so they cause contraction at the uterus. So they're going to be adverse effects as contraindicated in childbearing because it can be potentially abortifactant. We have octreotide, guys. Octreotide is it's a somatostatin analog, inhibits the production of splanchnic vasodilating hormone. So I remember it's a vasoconstrictor. It basically constricts. We're going to use this. It's inhibitory, so it decreases your growth hormone. So we can use this for acromegaly. We can use it for gastronoma. We can use this on like Ellison syndrome, glucagonoma. So acromegaly, varicose bleeds, and VIPomas, carcinoid syndrome, tumors. That's another one. That's an serotonin. Guys, recall that this can cause cholecystokinin. This can cause decreased cholecystokinin, so less contraction of bladder, so more likelihood of cholestasis. Sulfasalazine, guys, this is a combination of pyrimidine, antibacterial, and 5-aminosalicylic acids, anti-inflammatory, activated by colonial bacteria. Ulcerative colitis, Crohn's disease colitis, we can see malaise, nausea, sulfonamide toxicity, and reverse oligospermia. We can see where loperamide is a mu receptor agonist. This is going to be used for diarrhea. And this can possibly cause some constipation. We can have over here antiemetics. So we can see over here, for example, ondansetron, grenzosetron is a 5-HT3 receptor antagonist. This is going to be used in the chemotherapy. We can use this in decreased vagal tone, so this is used in chemotherapy, radiotherapy. It can cause QT prolongation. It can cause, the way I learned QT prolongation is that ondansetron, it can cause that kind of like the QT prolongation can cause serotonin syndrome. That can also be there. So that's going to be seen over here. And then we can also see that there can be or maybe a few other side effects, which is going to be also there. And then we can see that there's going to be, for instance, we can have over here proparazine, metoclopramide. So this essentially is going to be T2 receptor antagonist, and this causes increased gastric emptying, increased lower esophageal tone, and this is going to be nausea, vomiting, and it's going to be used in gastroparesis GERD. It basically antagonizes dopamine, so it increases prolactin, and that can lead to extrapyramidal side effects, anxiety. We have also eperitam and profesprematine, which is a substance P antagonist, NK1 receptor antagonist. So NK1 is substance P, and this can also be used in chemotherapy. Orlistat is going to be gastric and lipase. Guys, recall your gastric lipase is your chief cells of the stomach. They function by digesting the stomach. They can produce pepsinogen, which also is going to be there. So it kind of inhibits those pepsin, lipase, and that leads to weight loss, but it leads to steatorrhea. So we have some problems. We can have bulk forming laxatives. So we have over here, these are going to be basically bulk forming, means your P-silane methacellulose. That's going to be you're bringing in all of those fibers, so soluble fibers, into the gut and forming viscous fluid, which promotes peristalsis. Viscous means a thick, sticky consistency. Osmotic is going to be your, like we spoke about magnesium hydroxide, we spoke that as antacid. We can have over here magnesium magnesium citrate, lactulose, and polyethylene glycol. So they promote osmotic load into the GI, and we can see lactulose is really important for hepatic encephalopathy because lactulose converts to lactic acid, which the acid prevents, and ammonium becomes ammonia, and ammonia cannot be reabsorbed, so we can prevent lactic acidosis. We can see stimulants, laxatives, so we can see bacosidil, Sina. These are going to be basically enteric nerve stimulation, coronary contractions. We can emollient docusate, so surfactants reduce surface tension, so allows more water entering, and we can lubiprostase and chloride channel activator, increase intestinal secretions over here. So guys, that was GIT pharmacology.